My name is Dr. Mucheru. I'm a psychiatrist and I practice at Healthy Mind Consultants, Nairobi. Mental health is defined as, I'll start with good mental health because it's something that we should have for ourselves. It's the ability for me and others to love ourselves, first and foremost. Second, it's the ability to form relationships with other people, trusting relationships. You're able to love others and form trusting relationships. It's also the ability to take disappointments with stride and to be able to contribute to one's own community. So good mental health is something we would like for each of us so that we're able to love ourselves, we're able to love others and form trusting relationships, we are able to take disappointments with stride, and we are able to contribute to the community by doing what we should as our responsibility. We should be able to take our children to school, we should be able to be good neighbors, we should be able to go and work and come back to our homes without any difficulties in function. That is what is good mental health. Should one have mental health problems, then you may find the person has difficulties. One, functioning socially or occupationally, meaning they're not able to relate with others as they should. They're not able to go to school, for example, if you're a student, because that's your occupation, or you're not able to go to work and contribute productively to society. So then what happens when you have a mental health problem? You may have problems regulating your emotions. You may have problems with behavior. Your behavior may not be what is expected. Or you may have problems with your thought patterns, so that probably when you speak, you may not speak things that really add up, or you may find that you may have experiences that are out of the normal. You may have abnormal experiences, like situations where you believe you're not safe, or you believe that other people may not have the best interests at heart, your best interest at heart, or they may be wanting to harm you. So those are some of the problems we may encounter when it comes to mental health problems, just to name but a few. Mental health problems do vary, but common mental health problems include anxiety and depression. Those are the commonest mental health problems we have. And studies have shown that 4 in every 10 of clients who are seated in a general outpatient setting, just waiting to see the general practitioner or the medical officer, the general doctor in an outpatient setting, may suffer from either anxiety or depression. Then we also have situations where people suffer from severe mental illness, like for example, schizophrenia, for example, bipolar mood disorders. We have other conditions that clients do suffer from, depending on the age group. There's this phenomena of womb to tomb, so that children may have mental health problems, adolescents may have mental health problems, adults could have mental health problems. Patients in a ward setting, for example, women who have delivered may have problems. They could even have depression post-delivery, or even depression in pregnancy. Surgical patients who've undergone surgery may also develop mental health problems. And the elderly may also suffer from mental health problems. Specifically common is dementia, where people have problems with memory. The healthcare system in Kenya We have both the public health system and the private sector. And following devolution is the fact that health has also been devolved. So we have each county taking care of their health needs, and there is the national teaching and referral hospitals taking care of most of the referrals from the counties. So the healthcare system is such that it is in 6 levels. So the initial level, level 1, is at the community where people live, and that is where you have the community health extension workers, who are those who identify those who could be suffering from mental illness right from the community level, from the family level, from the households, from the neighborhood, and they're able to direct them to where they can get help. So at level 1, we have the community health extension workers being in charge, and they help us identify those people who need help. Then level 2, we have the dispensaries and small clinics in the locality where people can still see, for example, a nurse or a clinical officer who is trained to identify their mental health problems and initiate them on treatment. Depending on which treatment, they make a diagnosis and they're able to initiate them on treatment. Now, should they feel that this person needs more, further evaluation, they refer them to level 3. Level 3 is where you have the health centers and maternity homes, so that there are more qualified staff there. In addition to the nurse, the clinic officer, there is also a doctor who is referred to as a medical officer at that particular level. Then a notch higher, there is level 4, where you have the sub-county referral hospitals and some of the medium-sized private hospitals. They fall in that category. They take care of the clients who have been referred now from the health center. Then we go to level 5. Level 5 is the county referral hospitals. We have the 47 counties, and the large private hospitals, they fall in that category. Then now we have level 6, which is the national teaching and referral hospitals. So what would happen is a client seen next to their home would be initiated on treatment if the clinician there is able to handle that case. If they're not able to handle, or if the patient is not improving, they refer them to level 2. Although there are situations where the patient can be seen at the community, is taken to level 2, which is the dispensary, they still can't handle, they go to the health center, then they find the medical officer or the doctor there, who, depending on how severe the case is, would refer the patient direct either to a county referral hospital or to a national teaching and referral hospital, because there are some facilities in the county that may not have a specialist. For example, they may not have a psychiatrist, or even if they had the psychiatrist, they may not have some facilities. There are facilities like, for example, the electroconvulsive therapy, which is a theater procedure, which would be beneficial for some patients. So if from the word go, the doctor at the level 3 feels that this client needs referral, they're referred to the psychiatrist. If the psychiatrist feels, yes, they're at the county level, but they do not have this facility, then now they refer the patient for further treatment at the level 6 facility. So that is the referral pathway we have. But at the community, we also have what are called the community mental health clinics. The community mental health clinics are generally run by nurses, and they will ensure that the patient is followed up. The patient is evaluated, is put on treatment. If for example, the patient needs a monthly injection, they will quickly get their monthly injection from there. Community psychiatric clinics, depending on who runs them, there are some that are run by government, there are others that are run by the NGOs, that's non-governmental organizations. You may find a psychiatrist, even if the psychiatrist will come once or twice a month, working hand in hand with the psychiatric nurse. So this is very useful. The community mental health clinics are very useful because you're managed in your own community. So people know you, they see you improving, they see you going for treatment. You're able to function socially and occupationally under their watch. This reduces the amount of stigma. Then remember, this kind of facility is just next door. You may not need to catch public means of transport. You may just walk to the nearest county, the nearest probably county facility or sub-county hospital where this facility is available, or even the health center. Like for example, there is Kariobangi Health Center, which has been under the government since 1987. So people in that catchment area will be able to go to Kariobangi Health Center, get all their treatment needs. They'll be evaluated, they will get their injection, they will get a refill of their prescription, and they continue with their daily business. Then it eradicates stigma, it makes it more accessible, it's more acceptable. And unlike a situation where you have to walk to a national teaching and referral hospital, you may need somebody to accompany you. So that means you spend more when it comes to transport, you go and find a queue there, then you also increase the number of patients who are waiting there. So as much as possible, community mental health clinics are very useful when it comes to providing treatment at the community. In addition to just getting the treatment, it's not just about medication. They also get some free counseling services, and there will be home visits by a social worker. For those who are not able to come to the facility, or a patient who has been coming to the clinic suddenly has disappeared from the clinic, then you will find that those people are able to, the social worker is able to reach out to them. So then there's that continuation of the chain of care, so that you just don't see a patient once and never see them again. And probably they have a chronic, severe mental illness which needs lifelong treatment. These are people who will need to be followed up. So then the social worker in this case will go and make a home visit and find out, are there any social issues that are preventing this patient from coming to the clinic? Or maybe they got a fracture, that is why they didn't come. And if they're able to have the fracture treated, the next time they will be able to come. So it becomes a very good situation where the patient is managed in their own community with people who know them, who see them go through the motions of the illness and get better, and probably then take up jobs and become useful members of society. I have a hypothetical scenario here of a relative who is living in a rural part of this country where they don't have basic, they have to walk to the nearest health facility, and he now has presented with bizarre behavior. He's not sleeping at night, he's hearing voices, he's a bit violent, and he is also using some substances. You've mentioned alcohol, you've mentioned cannabis, and now we need help for him. Now, first and foremost is to find out who are his support, because if he has a wife or he has a brother or a sister, they should come together and try as much as possible to get him to the nearest health facility. Sometimes it can get a bit challenging to get the person there on foot. They may want to ask somebody in the neighborhood who has a vehicle to help them take the client to the nearest health facility. Now, at the nearest health facility, which may be a level 1, they may find, or probably even before they get to the community, there might be a community health extension worker who can help them get in touch with the level 2 facility, which is a health center where you may find a nurse or a clinical officer who will be able to evaluate this patient. During the training of a nurse, a clinical officer, they go through a rotation in mental health, and they're taught how to identify common mental health problems, make diagnosis, and initiate treatment. And after going to the level 2 facility, if they feel this patient is not amenable to outpatient care, maybe this patient will need to be treated as an inpatient, they will refer to the level 3 facility, where the patient may get admitted and get help, even from a medical officer who I said is a doctor. The doctor has also been trained during their medical school to identify mental health problems and to initiate treatment. The same doctor will take a thorough history, will also ask for some tests to rule out physical or to rule out medical causes of these symptoms, because you may have an infection, including malaria, which can lead to somebody behaving abnormally. Other conditions, medical conditions, can also present with abnormal behavior, despite the fact that you have also said that the cousin has been using cannabis and has also been taking plenty of alcohol. So then, from then, should the medical officer or the general doctor feel that this patient is not responding well, they need to consult a psychiatrist. If the psychiatrist is available in the county referral hospital, then the patient may be referred to that facility. Then, in the county hospital, you may have members of the mental health team. The mental health team is headed by a psychiatrist, there is a psychologist, there is a social worker, there is a psychiatric nurse, and an occupational therapist. So these people will work together to address the needs of this relative. And what will happen is the psychiatrist will do the medication and will also foresee or will also oversee the treatment being given by other team members. The psychologist will talk to this patient once the patient is amenable to talk therapy. Because this person who is violent, who is hearing voices, who is not sleeping at night, probably is a bit disinhibited, may be difficult to talk to the way we are talking here. So for a patient to be amenable to talk therapy, they need their symptoms, their severe symptoms, or the psychotic symptoms, those that show that the patient has lost touch with reality. They need to be handled first. So we sort out the psychotic symptoms. The patient now is in touch with reality, then is now linked up with a psychologist who will then take them through talk therapy, will talk to them about their addiction, will do counseling if need be, and identify any challenges they may have that could be fueling their addiction or which could have led to the current presentation, because stress can cause somebody to present with mental health symptoms. So then Like for example, we are talking about the talking to themselves or hearing voices, among other symptoms. Then now we are talking about the nurse. The psychiatric nurse is a useful team member who will also help with administering the medication for this patient. The occupational therapist will help with rehabilitation. They will teach the patient activities of daily living. They will teach the patient a skill so that once they leave the hospital, they're able to be productive members of society. So, depending on the level of the hospital, some may be able to teach tailoring, welding, carpentry, cooking. All those may be taught under occupational therapy. Then the social worker needs to reach out to the relatives, needs to find out who is going to take care of this person. Are there any social problems in the home? Do these people have a living arrangement? We are yet to get there, but in other countries, we have halfway homes or organize a situation where people get living arrangements, especially for those who are homeless. Because unfortunately, we may find that our patients may not be able to hold a job, especially if they have severe mental illness. So they may be hopeless. They may be homeless. So if they're homeless, then they need somebody to accommodate them or some place where they can be taking their medication from. Otherwise, there's no way we will give medication, give psychotherapy, teach you activities of daily living, then discharge you to the streets. So all these people must work as a team. So from the county referral hospital upwards, the national teaching and referral hospital, these members of the mental health team work together, not only when the patient is admitted, even when the patient is an outpatient. And as I said, depending on what the diagnosis is, the age of the patient, they will give tailored solutions to that specific diagnosis, the age group. If it's a child, for example, the child is hyperactive, has attention deficit hyperactivity disorder, we'll come and see the psychiatrist. Then we'll also go and see the occupational therapist as part of their follow-up. So these are people who will, the mental health team members, will not only work for inpatients, they will also work for outpatients and rehabilitation of these people so that they're reintegrated back to society.